mission is to create this community for previvors. So, as you see in this picture, previvor thrivers, we consider ourselves. Previvors are not survivors. We have not had cancer. It was knocking on our door, but we haven't had it. And then we are determined to make sure we don't get it. So we are considered previvors. The head of Force, Sue Friedman, coined that term many years ago. And it really gives us a sense of being part of a community. We are people who are actively fighting against cancer. We are not just sitting back and thinking, oh, it happened to my mom, it'll probably happen to me. We're not doing that. We are actively fighting it. So we consider ourselves thrivers, not just previvors. And so we want people to feel that. I know for me, I felt a sense of community that really kind of emboldened me to search out and create teams with my doctors who may or may not have the knowledge that I have about my genetic mutation. So it gives us that sense. And we are, in our activities, we are thinking about all of this because it's impacting us. We're thinking about how we can reach people, how we can make them feel emboldened, empowered, and not afraid to fight. So community is really important for us. Understanding all that, and I know I've gone over my 5 minutes, I'm sorry, but you see the passion. Getting started, I want to first say that we're going to have our two wonderful speakers as, again, part of our mission to educate and build community. We have Sara Richter, who's going to talk about the guidelines the American Cancer Society recommends for when you should do screening and how at-risk screening works and how to support yourself and others with that. And we'll have a 5-minute question and answer after that. Please put your questions in the chat. If we're not able to get to your question, after the program ends, we're going to stay on for 15 minutes after. And then if you could do that, we can probably get to your question because we want to give time to both presenters so they can present their 20 minutes. So then after Sara does hers, then you'll hear from Alana, who will do the workshop on Scanxiety, which is very important. As we know, fear is probably the biggest factor in how people end up not getting the treatment, the screening that they need because of the fear of cancer, because of their experiences. So we know it's really important that we address the emotional part of what it's like to be a previvor and how we are actively in real time supporting ourselves and emboldening ourselves and sharing that with you. So we look forward to it. So I'm going to stop talking because I can go on forever. And next, my sister Jacinta will introduce our first speaker. Thank you.
All right, thanks, Sheila, for the overview of our why we do what we do. So next we have Sara Richter. Sara is the Associate Director of Community Partnership for the American Cancer Society. She works across Wisconsin to develop and strengthen partnership with community clients and organizations, helping expand access to cancer prevention, early detection, treatment resources, and survivorship support for individuals and families statewide. So Sara, thanks again for joining us on today.
Well, thank you so much for having me. I'm going to pull up my presentation here. And just let me know that you can see it.
Yes.
Yes.
Okay, wonderful. Well, I appreciate that lovely introduction, and it's wonderful to hear about the importance of empowering individuals. I think that is also why I ended up at the American Cancer Society. I too have a family that's very affected by cancer, and I believe that knowledge is power. And so today we're going to spend some time talking about prevention and early detection strategies for individuals with genetic and family cancer syndrome risk factors. Wow, that's a mouthful, right? I'm going to start by, again, talking about the benefits of cancer screening, talk about the difference between average risk and high risk individuals, and then share with you some trusted resources and tools to support self-advocacy. So we all know cancer is that out of control growth of abnormal cells, and sometimes those bad cells infiltrate those good cells, and that's how the disease spreads. And we know that cancer is a disease that affects 1 in 2 men and 1 in 3 women. And despite all that, there's still populations or types of cancer that we don't know that much about. So that's why it's so important to keep the communication going. We know that fewer than 1 in 10 new cancer diagnoses are linked to inherited genetic risks, but that portion is much higher. We see like 10 to 20% of those cases in ovarian, pancreatic, early onset breast, and metastatic prostate cancers. So here's a chart that kind of just gives some of the cancer types, the genetic risk factors, the primary inherited syndromes and genes, and then why that's important. And one of the things I just wanted to talk about as an example is breast cancer in men. We see that a lot of times we don't talk about male breast cancer, right? It's like taboo. I feel bad for men who have breast cancer because we've pinked everything for breast cancer. So these poor men just are feeling left all alone. And so we really need to change how we approach this, right? We know that again, 5 to 10% of newly diagnosed with inherited genetic risks associated primarily with the BRCA2. So we are seeing more men developing breast cancer, and we want to continue to like normalize talking about it so men are aware that they need to find out information to see if this is something that they could be affected by. And that's just one example. So we know genetic testing is a really important tool. It's been out for a while, but when it was first started, it was very expensive and hard to access. I'd like to believe that that has improved, and there is, of course, still room for improvement. But I would say, if you haven't had genetic testing in 5 or 10 years, that might be something that you would want to talk about doing again since the testing has changed a lot. I would say that accessibility is improved because the one benefit of that happened with COVID is now we can do virtual visits. So even if you don't live in a community that maybe has a genetic counselor, it's possible to have a virtual appointment to speak to a genetic counselor, which is again improving that access to care that we want to see. And I feel like now genetic testing is probably around $150 to $200 in many of our important healthcare centers like MCW that's joining us today do help with assistance programs if that's necessary, because we really want to make sure that people who need care have access to it. But the genetic counselor is a great person who can help start that conversation in cancer risk assessment and genetic testing. And it's important to really understand the pros and cons of that to determine if it's a good fit for you or for other members of your family. And I also highlighted here is on cancer.org, our American Cancer Society website. We have a list of resources as well to help you understand if genetic testing is right for you, or what questions you might want to ask, or just how to better inform yourself before you sit down with a genetics counselor. So just shifting a little bit to what is cancer screening, right? Screening is testing to find cancer or other diseases in people who have no symptoms. So the goal is to really find it when it's small and it hasn't spread, with the idea that it'll be easier to treat. And so we know that we have average risk and we have high risk individuals. And most of the time when you're hearing people talk about cancer screening, you're hearing them talk about average risk, and they're not usually saying average risk. But why it's important to know the difference is because there can be a very different screening process, whether that's when screening begins, how often your screening should occur, which tests should be used, and how screening decisions are made. So here is a look at our average risk screening guidelines for people without symptoms. Again, breast cancer screening starts at 40, cervical at 25, colorectal at 45, and prostate at 50. Now we take a turn and we look at what does that mean for patients that have high risk. And again, those are still individuals that are not exhibiting any symptoms. And there's a lot more, bullet points to give consideration to. And so we'll get into some of those as we continue through the presentation. So first, when I talk about breast cancer, I always try to remember to tell people that if you're exhibiting any symptoms, you should go and see a provider right away. There's a list of symptoms. A lot of women too think, and men think that a mass is what has to happen first in order for it to be cancer. And that's not true. You can get breast cancer without a mass. There could be pain, swelling, changes to the nipple, changes to the skin, discharge, swollen lymph nodes, dimpling. There's lots of different symptoms that can appear. But when we see symptoms, we should be not waiting until a screening guideline. We should be seeing a provider right away. And when we talk about screening for breast cancer, the standard of care is a mammogram, which is that low dose X-ray, where we take the two plates and we flatten the tissue till we think that we couldn't be more of a pancake. And that really shows us a picture of what that breast tissue looks like. When we have patients that have high risk for breast screening, then there's an additional step of MRI that's added to the picture. So how do we know if you have high risk? Well, lifetime risk of breast cancer would be 20 to 25% or greater, determined by a validated risk assessment tool based on family history. Now, there's lots of different tools, and not all tools are equal. So that might be another good question to ask, for your provider, which assessment tool are you using, and how does that differ from the other tools? And then we also have this problem where if we talk about family history. Now, I took my husband to the doctor once, and he was struggling with the diagnosis. And the provider said, well, he said he didn't have a family history. And I said, no, he said he didn't know his family history. A lot of times we didn't talk about family history. We certainly didn't talk about cancer, right? So we need to normalize talking about these hard topics and sharing our family history. And I think that's why this organization is so powerful, right? We need to normalize that this knowledge is power. We want to share this with the people we love. So again, another high-risk factor would be that BRCA1 or 2 gene mutation, the first degree relative, whether a parent or sibling that might have a gene mutation, radiation therapy to the chest before 30, and then we have like a whole nother slew of syndromes, right? So as Sheila mentioned, there's lots of things that are going on, and I'm just kind of highlighting the big picture. So certainly it's not inclusive of everyone, but at the end of the day, the purpose of this is to start having those conversations and feel comfortable advocating for yourself. So one of the questions we get all the time with women who are in high-risk screening guidelines is, do I really have to get the mammogram and the MRI? Can't I just skip the mammogram and get the MRI? And the answer is no. Right now, we need you to have both. And it really is to have a better view and a better picture of what's happening. And so that might change at some point, but right now, that is the recommendation. And also, what insurance requires is the mammogram first and then the MRI. And so most women at high risk should begin screening with MRI and mammograms when they're 30 and continue for as long as they're in good health. But again, I'm going to say this, these are guidelines, right? They're not laws, they're not rules. And when we talk about high-risk patients, you are not in the bell curve, right? You're outside the bell curve. You're so special. And so your needs might be very different than other people's needs. So just because this is what is recommended doesn't mean that it's the hard and fast rule for you. So always talking about your provider to understand those personal circumstances and preferences is really key to success in being empowered and advocating for your best health outcomes. So we also heard from Sheila about risk reducing surgery, right? So people who have high risk it's becoming more popular to have prophylactic surgery, whether that's a mastectomy, whether that's having, we'll hear from in other slides, we'll see people having their ovaries removed, their fallopian tubes, sometimes their uterus, right? So there's different considerations once bearing children is no longer a preference. So I think we're seeing more providers, and I love that we're normalizing talking about that because I think that knowledge is power. So when we talk about colorectal cancer screening, the same thing, a list of signs and symptoms. This means you should be seeing your provider right away, not waiting until your age of a screening. These are things that are not normal that you need to have addressed with a provider. So change in bowel habits that last more than a few days after you've had a bowel movement, but you still feel like you have to go and that feeling doesn't go away. We see rectal bleeding, blood and stool, cramping, abdominal pain, weakness, and fatigue, and unintended weight loss. These are all, again, signs that you should be seeing a provider. And then we think of like, what are the high risk individuals? A personal history of colorectal cancer or certain types of polyps, a family history of colorectal cancer or polyps, a personal history of inflammatory bowel disease, that could be Crohn's or colitis. It could be irritable bowel syndrome, right? A confirmed or suspected hereditary colorectal cancer syndrome, a personal history of getting radiation to the belly or pelvic area. This all means that when you do get screening, the colonoscopy is the recommended screening for you. If you're average risk, there's lots of different options available for at-home testing, but for high-risk individuals, the colonoscopy is the way to go. And when we look again at family history or those familial adenomatous polyposis or Lynch syndrome, there's lots of other syndromes or gene mutations that require unique screening schedules, and they're all listed here. I'm not going to read them to you, but this presentation will be available to you after today, and you can go back and look and see. But again, this just shows you the variety and the uniqueness of each of these syndromes and how they have to be treated differently. And so I'm going to guess that your primary care doctor probably doesn't have a big grasp of each of these things as well as maybe they would like. And so that's why really leaning into your specialist, like your gastroenterologist, will really help you get that personalized care. Endometrial cancer. The American Cancer Society recommends that anyone with Lynch syndrome who can get endometrial cancer should be offered yearly tested with a biopsy starting at age 35. So again, before doing that, doctors should really talk about the tests, including risks, benefits, and limitations. Risk-reducing surgery is also becoming more popular with people who have Lynch syndrome, having their uterus, ovaries, and fallopian tubes removed once bearing children is no longer a preference. And again, the removal of ovaries and fallopian tubes also reduce the risk of ovarian cancer. And there are risk-reducing medications that can be taken, oral contraceptive pills that include estrogen and progesterone, or progesterone-only contraceptives, and the protection lasts 10 years after the medication's discontinued. And there's also IUDs, both progesterone containing and copper containing, that decrease the risk of endometrial cancer. So we don't hear a lot about endometrial cancer, and it's because there isn't a screening for average risk. We know that symptoms are primarily the reason why somebody would be coming in to be seen, unless, again, they have identified that they do have one of these other syndromes that would make them more at risk. But abnormal vaginal bleeding is the most common symptom of endometrial cancer. And again, there's many factors that increase the risk for endometrial cancer. Many of them cannot be controlled, right? You can see the list here. I won't read everything to you. And that there are factors that lower the risk for endometrial cancer. So again, the oral contraceptive pills, the IUDs, hormone replacement therapy, pregnancy, and exercise. And then we take a brief peek at ovarian cancer. Again, you'll see the list of syndromes that are affected by this. Currently, there's no effective screening test for ovarian cancer. Again, risk-reducing surgery is growing in popularity to remove those ovaries and fallopian tubes once having children is no longer a preference. And risk-reducing medication can be utilized to talk to your doctor about the benefits and risks and timings of oral contraceptive pills and the IUD, which may lower the risk of ovarian cancer. So the most common symptoms for the ovarian cancer are bloating, pelvic or abdominal pain, trouble eating or feeling full, and then urinary symptoms, so that urgency and frequency becomes a problem. Here are a bunch of factors, right? Older age, inherited gene mutations, BRCA1, 2, or Lynch syndrome, starting menstruation before 12, starting menopause after 52, not having pregnancy, endometriosis, and radiation exposure to the pelvis. So again, we highlighted a few ways to reduce your risk of ovarian cancer, very similar to endometrial cancer. Thyroid cancer screening is another one that's a little tricky. We don't have a normal screening process. Often, patients come in with symptoms, whether it's a lump in the front of their neck, swelling in the neck, pain in the front of the neck, or going up to the ears. Sometimes people have hoarseness or voice changes that don't go away. Trouble swallowing or breathing, a constant cough, even though they don't have a cold, and a lot of, lumps can kind of occur in the neck area. So many factors really determine when asymptomatic screening should occur. Very few individuals benefit from screening, so it's really up to you and your doctor to determine if this is a good fit for you. And again, risk-reducing surgery is available with prophylactic removal of the thyroid gland, which is recommended for people with some of the gene changes that are listed here on the slide. So thyroid cancer is actually 3 times more common in women. It's most common age 30 through 60. There are, again, a list of these hereditary conditions that really exacerbate your risk factor. Again, family history, first-degree relative, whether that's parent, sibling, or child with thyroid cancers, and radiation exposure, excess body weight, which is I think actually considered to be a risk factor for most cancers now. Iodine in the diet is another unique one. And then to bring it home, we're going to just touch on prostate cancer. This is another one where a lot of men start having these symptoms as they get older and they don't talk about it. So if you are experiencing problems urinating, blood in urine or semen, trouble getting an erection, pain in your hips, back, chest, or other areas, weakness or numbness in the legs or feet, and loss of bladder control or bowel control, you need to be seen right away. And we look at those risk factors again with families and genes, and we know that there is definitely some relations, which we'll get into. Prostate screening was a digital rectal exam, right? So men in general don't want to go to the doctor, and then we finally get them to the doctor, and the first thing we do is put on a rubber glove and stick a finger up their bum, and we wonder why they don't want to come back. So right now, really, we're seeing more prostate-specific antigen blood tests being done for screening for prostate cancer. I think this is a much more agreeable starting point, building a relationship with your provider, and again, probably a better, more accurate way to determine what's going on. Prostate screening has gone through a lot of changes, and we know that Black or African American men have a much higher risk. We also know that if you have a family history, whether one first-degree relative, a parent, or sibling that's diagnosed under age 65, then you want to start screening at 45. And if you have 2 first-degree relatives, or you have the BRCA1 or 2 gene or Lynch syndrome, then you want to start at age 40, right? So I think because the blood test is relatively inexpensive, and accessible at most doctors' offices, we don't see as much of a struggle with getting men to get these screenings as we do with some of the other tests. Really, the most important thing that we want to leave with today is knowing how to advocate for the appropriate prevention and early detection for you and your family. And the American Cancer Society has developed this Cancer Risk 360, which is a free web-based tool that you can use to assess your risk and receive personalized recommendations as to how to reduce that risk and improve overall health. And you'll see here, we highlighted that even genetic mutations and hereditary cancer syndromes, family history, all of that stuff is taken into account, will help you kind of create that action plan, including a list of questions to ask your doctor. So if you're like me and you're like, oh, I don't know where to start, this is a great starting point. It'll get you some things to really be able to print out and take to your next appointment. But the advocacy is key, and no matter how frustrating this is, starting at the beginning every time is my recommendation. Despite having these incredible EHR systems or electronic health records, not all the computers talk to each other. Sometimes systems go through upgrades. Hospital systems merge. Sometimes all the records aren't exactly the way that they should be. Sometimes our healthcare workers are asked to do so many things in one day that maybe they're not noticing that you're high risk. And so they're maybe going to be talking to you about average risk, right? So really always starting at that family history or that personal risk summary is my recommendation at every appointment you go to. It'll help the doctor kind of snap out of that routine and remember, nope, this is not the average risk. We need to flip my brain onto high risk, right? So really actively navigating those screening logistics, you are responsible to understand your insurance coverage and what prior authorizations are required when you have high-risk modalities. I would say, again, our specialists are maybe have a better handle on getting some of those prior authorizations through. And like we heard earlier from Sheila, kind of having some of those high risk assessments or genetic testing will often give you the documentation needed to get coverage for some of the things that we talked about. So I always recommend engaging the right experts. Again, asking for referrals to specialists in high risk care is critical, whether it's a genetic counselor, whether they have high-risk clinics, whether it's a specialist like a gastroenterologist or breast specialist or a genetic oncologist. I think these individuals are seeing more types of patients that are like you and better equipped to take the time to manage those than maybe primary care, who is used to seeing average risk and might not know all the information. It's not to say that primary care couldn't or wouldn't, but I'm just suggesting I think that the specialists are often warranted for these unique cases. I always recommend bringing someone with you when you go to your appointments. It's important to have your questions written out because you're always going to forget something, and then you're going to be like, oh, shoot, I meant to ask, right? So, and then it's hard to hear everything that's coming at you. So someone else who can be taking notes is really helpful. And then I always recommend whenever you're talking about, what that recommendation might be, to really ask what are the benefits, what are the limitations. And so you're feeling like you're making fully informed decisions and that you're sharing that decision-making power with that provider. There is this great patient portal, right? I think we often aren't using it to the best of its ability, which again, referencing guidelines or prior recommendations and messages to reinforce your request. Asking for written follow-up plans after visits so you have a clear time and modality of what you're supposed to be doing. I think it's good to ask clarity, about the recommended screenings. Have they, to make sure they've been ordered or scheduled, because sometimes there's a silence or a lapse and we don't want to fall behind on things. Again, that redundancy in your care, really knowing when you're due to have stuff done instead of waiting for them to tell you, or when it says your results are normal, to make sure that context of, was it interpreted in a high risk context versus an average risk context, I think will really help. And then advocating for any prevention beyond screening, right? So, what risk reduction medications or procedures are available? What kind of other referrals for lifestyle, nutrition, smoking cessation, or other things you could do to reduce your cancer risk? Inquiring about clinical trials or registries designed for high-risk populations. These are all great things you can do to advocate for yourself. And then normalizing, right? Self-advocacy. So to be using that clear language, because I'm at high risk, I want to make sure I'm not following through an average risk process. So I think sometimes when people advocate for themselves, they're afraid that they're too bossy or they're too assertive or they're too direct. But I think this persistence is really not about being difficult. It's about being informed. And you have that right, and you need to be, your strongest advocate for yourself and your family. And if you don't feel like you're being heard, then get a different provider. Sometimes it's just not the right fit, or sometimes, again, a specialist might be the better fit, or sometimes you're like, hey, maybe I want a second opinion just so I can feel validated that I'm on the right track. And all those things are your right, and you shouldn't be apologizing for that. You should be commended for really being empowered and advocating for yourself. And that's it.
Thank you so much. That was wonderful. Pat, did you want to?
Sorry, I was still on mute. Thank you so much, Sarah. So for a few minutes, we're going to quickly take some questions, and there are actually some questions in the chat. So I'll just start there and then see if we still have time. So we have a few men in the audience, and one asked, how does BRCA1 and 2 gene mutations affect men differently, particularly in relation to breast cancer risk? And then the other question, which you might be able to answer both at the same time, is since routine breast cancer screening isn't common for men, what signs should men watch for, and are there recommended screening protocols for high-risk individuals? So let's start with those two.
Yeah, thank you for that. That's great questions. I would say I think it's like 1 in 726 or 728 men in the normal average population get breast cancer. So it's not talked about as much, and there's not like regular routine screening that's recommended. The list of symptoms that I had for women would also be the same for men, right? So there could be like tenderness, heat in the skin, changes in the skin, changes in the nipple, swelling, discharge, pain. All those things are symptoms that something's not right. It's probably even more difficult for men to advocate for screening for themselves because it is so uncommon. So you might, have to really be persistent about the fact that this is a problem and that you are concerned. Um, in terms of BRCA mutations, it does seem that the BRCA2 shows like about 5 to 10% of men kind of in that breast risk category. So if you are concerned, like I think genetic counseling would be the first step. And if you do have one of those genes, then having that genetic counselor sort of provide you some guidance on what are the best next steps for you. I know there's high risk breast cancer clinics, and that might be someplace where you would start, and start having some, conversations about what is the right step for you. Um, I'm not sure if that fully answers your question, but I am not a provider, so I don't want to speak above and beyond my scope of understanding. I think the biggest thing is to have those conversations in the healthcare system, to understand sort of what actions you can take, and then to just advocate for those next steps.
Okay,
Does that
great.
help?
Yes, I'm sure it does. I'm going to read another comment and then there's a couple more questions in the
Sure.
chat. So, Dr. Card says, very good presentation and appreciate the encouragement for screening and at least starting with your primary care physician. The guidelines are just that, as you said, guidelines, yet they are extremely helpful. Agree that family history is very important for preventative care. Great presentation. And then there's another question that reads, what type of screening is recommended if you have dense breasts?
Yeah, great question. So breast density is a hot topic. If you have dense breasts, legislation was passed that you had to be notified you have dense breasts. But there's no recommendation. Like, what does this mean? What should I be doing differently? Right? So it's very confusing. And the American Cancer Society has what we call our Cancer Action Network, which is our advocacy arm, where we have spent the last 6 years partnering with other advocacy organizations and getting Gale's Law passed this year, which means starting in January of 2027, there is an insurance mandate to pay for additional screening if you have dense breasts. So right now, if you have dense breasts, it's really up to your provider to make a recommendation to say, hey, you should have additional screening. And a lot of times what's happening is even if that recommendation is made, because it is not covered by insurance, as like the mammogram is covered, then patients end up with big bills. And as a result of knowing that, a lot of women are not completing those additional screenings. So a lot of times with people that have very dense breasts, they go to the high-risk breast cancer clinic and they would get, a mammogram and then they would get that MRI. Sometimes the provider might want an ultrasound instead. And that might be because it's a more accessible test, it's less expensive, and so it can give yet more viewpoints of that dense tissue. There's a lot of confusion about dense breasts, right? Size is not at all relevant. So you can have small breasts and still have dense tissue. You can have large breasts and not have dense tissue or anywhere in between. The problem with dense breasts is like it's just very hard to see what's in there. And so by doing those additional tests, they get better visual field, and then they can compare what they're seeing on the MRI and what they're seeing in the mammogram and try and, get a better picture of what's going on. And so it's really, really critical if you have dense breasts to like ask some additional questions. Well, I've heard I need additional screening. Could I go to the the high risk breast clinic to understand what that is? Could I speak to a financial navigator to understand what the cost of that is? But with Gale's Law, the hope is that in 2027, again, that those additional costs won't be impacting patients from being able to access the care that they need and they deserve.
Okay. Here's
Thank
the last
you.
question.
Oh,
If you're able
I'm
to
sorry.
answer it in 30 seconds, because someone sent the question directly to me. What are the cons of getting genetic testing? Are you able to answer that in 30 seconds?
Yeah, I think the biggest thing to think about is you are getting your insurance through an employer. You're getting your life insurance often through an employer. And so when you start knowing about some of these risk factors, it might make it harder for you to obtain some of these life insurance afterwards, right? You're now not average risk of getting something, you're high risk of getting something. And once that documentation exists, you could be priced at a higher rate to purchase those services. It's not to say that you shouldn't do it. It's to say, like for myself, before I would get genetic testing, I would probably buy life insurance through someone outside of my employer group. And then I think this is like a really great segue, right? Because our behavioral health therapists can really help us kind of navigate that harder conversation, which is like, do you want to know now that you're at higher risk? How are you going to manage that anxiety? And then you have a family, and some people are going to want to know, and some people aren't going to want to know. And so, how do you not let that become a place where you divide? Um, and so I will turn it back to our next presenter
Yes,
who
thank
will
you.
have a lot of insights on how
Thank
to
you for
maybe go
that.
through some of that.
Thank
Yes.
you. Thank you for that.
Before you speak, Sheila, I just don't want Allison, who put a question in. If you can hold on Allison to the end, we'll have our other speaker speak. And then if Sarah can come back and address the last question in the chat, that would be helpful. Thank you.
Okay, thank you. I'm going to jump right in as we're running out of time. I want to apologize. I hope you guys can stay on a little bit longer. We have already agreed to stay on, so please do. I will introduce our next presenter, Miss Alana Yanagida, LCSW, is a behavioral health therapist in Inova Seville Cancer Screening and Prevention Center in Fairfax, Virginia. With over a decade of experience in behavioral health, Alana helps individuals, including myself, navigate cancer risk, screening, and prevention, focusing on empowerment, resilience, and whole person wellness. Come on in, Alana.
All right. Thank you for having me. So before I proceed, I'm just going to make sure everyone can see my screen. Is that correct?
Yes, we're in.
All right, perfect. So thank you so much for having me. I am a behavioral health therapist, and one of my roles at the clinic is to discuss Scanxiety. So today, what we're going to do, and I'm hoping, there we go. There's the next slide. We're going to just kind of briefly do an overview of what Scanxiety is, what are the signs and symptoms of it, and then really the bulk of my presentation is going to focus on how to manage Scanxiety. We're going to practice a couple things together. My hope is that you can leave today with some tangible tips that could be really helpful for you as you go through your screening process. So, what is Scanxiety? Scanxiety, I think, is more commonly known now, but still very much new to many. And so, Scanxiety really is a term. It's not a diagnosis, but it's a term that's utilized to describe the all encompassing fear, anxiety, and worry regarding scans and imaging. Okay. I always tell people it's a very common response, but everyone can feel it differently. And when we think about, like, why do I have this overwhelming at times fear or anxiety or worry, it really makes sense. Specifically, when we think about Scanxiety, it's a lot of times tied in with these cancer screenings, whether it's a mammogram or an MRI, but it also can be felt for any type of medical screening. So there is that risk, right, that you could get that diagnosis or that you could get bad news, right? And so think because there is that risk, a lot of people feel very nervous and worried around this time. Scanxiety can be felt before. Some people will start feeling it, in the weeks leading up to their scan. They'll feel it during their scan, and then a lot of people say the worst for them is that after part when they're like waiting for the results, right? And Scanxiety can be felt for routine scans. So I know we heard about like the screening guidelines, right? You can feel it for those yearly mammograms, for example, but you can also feel it for diagnostic scans or follow-up scans, seeing if there's anything that has grown or changed. When we use the term Scanxiety, it really is all encompassing of all the different screenings. So this could be an X-ray, an MRI, a CT scan, a mammogram, but it also could be a blood test or a biopsy. So again, what Scanxiety is that overwhelming, usually fear, anxiety, and worry. So some signs and symptoms. So emotionally, it's very common to feel nervous or worried. Some people experience mood swings. They have an increase in irritability, less patience, less enjoyment in things. Some physical signs can include an inability to sit still, just needing to stay busy, sweating or feeling flushed, an increase in heart rate, changes in appetite. Some people eat more, some people eat less, muscle tension, headaches, backaches, difficulty sleeping, and then definitely cognitively, just that recurring worry or fear, and difficulty concentrating. So again, everyone feels it differently, but you can feel it before, during, and after. And if you look at these signs and symptoms, right, this can really impact your day-to-day life, right? This can really take a toll, especially if you start feeling it as the weeks are leading up to it. People will talk with me about how this is really making it hard to get work done or being around family and managing responsibilities. So this is what we're going to focus on is how do I manage these feelings? Because it's important to know that one, it's valid to feel this way, right? But two, we want to manage it because quality of life is important. But also, we don't want these feelings to become so overwhelming that you don't engage in these screenings, right? Because these screenings are vital to your health. And so we want to be able to find ways to manage it so you can get through this time, and make sure that you're as healthy as possible. So we're going to break it down and just go through just some concrete steps. So just concretely before your scan, it's really important to talk to your medical team. Ask questions, know what the screening is, what to expect, how long, what does it mean with or without contrast? Ask these questions. Bring a family or friend with you so they can help take notes, so they can help be a second ear. Ask your doctor, how long will it take to get my results? Where am I going to get my results? Is it coming through my chart, my electronic portal? Is it coming from a phone call or an appointment? When it comes to scheduling your screening, I recommend scheduling it first in the day, if possible, right? If you schedule it first appointment of the day, hopefully they're going to be on time, right? So you can kind of get in, get your screening done and leave. But also it can be really hard if your screening's at 3 o'clock in the afternoon and you're trying to get through your workday until then. Consider bringing a friend or a family member with you. They can be a great distraction, right, on the car ride over, but it also can be so comforting to walk out of your screen and walk into the waiting room and see a familiar, loving face. And then when you're in that waiting room, do some calming activities. And we're going to talk about what some of those activities can be. So during a scan, and I tried to come up with some different, what I would call coping skills that you can utilize. And some of them you can do in some scans and some of them you can't. But these coping skills you can also utilize before in the days leading up to the scan or after as you're waiting for the results or just in general. Like I tell everyone, we are all only human. I need coping skills. I use coping skills. It's how we manage with emotions. We don't have a crystal ball. We don't know what's coming up in front of us, right? So we all need coping skills. So I really just kind of want to normalize that as much as possible and say, like, these are good skills to have. Okay. The first two on the list, square breathing and meditation and positive imagery, we're actually going to practice that together. So I'm going to put it to the side for a moment and just provide a couple other ideas. And again, these are ones that hopefully you feel like you can use no matter what the scan is, whether it's an MRI or a CT scan, that you can utilize them. So another thing that really help people is to create or say a personal mantra. I have people that sometimes, maybe there's a quote that they really lean on, or something that a family member said, or a Bible verse, or a song lyric, or something that they created themselves, right? That they can just repeat to themselves over and over and over to kind of help ground them, right? So some people will say, I can do this, right? And so maybe they're getting that MRI, and as they're in that MRI, they're saying to themselves, I can do this, I can do this, I can do this, right? None of these coping skills take away the fear, but the hope is that when you utilize these coping skills, you can feel like you're more in control rather than your anxiety or your scanxiety being in control. Another one that I think can be really helpful is counting. And so there's different variations. You choose what works for you, right? So you can count forward or backwards, but this is a good distraction technique. So say you start at 100, you want to count down by fours, for example. You choose a number that is a little challenging, but not too challenging, right? Because you're already feeling a little bit overwhelmed. So maybe you start at 100 and going down by fours, you go 100, 96, 94, 90, not wait, 100, 96, 92, 88. See, I had to stop and concentrate, right? And so that's one thing that you could do. You can count down by threes or twos and utilize that, as you're trying to kind of stay in that moment, but distract yourselves from what's going on. Another distraction technique is to name items in a category. So choose any category. Maybe you love fruits and vegetables, cars, TV shows, animals, countries, right? The idea is to just name as many as you can. Right. So maybe you love to travel or you want to travel, right? So you're sitting there getting your scan and you try to name as many countries as you can, or you try to name as many fruits as you can. So you might say, okay, apples, bananas, pears, peaches, raspberries, what else? Blackberries. So see how the longer the list goes, right? You're really having to focus on that rather than what's going on in the moment. And that's the goal of these coping skills is again to kind of help you get through this time because it's really important to get these screenings done. I also always tell everybody, tell the technician if you are uncomfortable, if you are anxious, if you need to stop. Several reasons why, right? It's important to let them know what's going on in your body. They don't know. But also, these technicians do these screenings day in and day out, and they may have some really good tips for you, right? Like for some scans, you might be able to get music to come in over the speaker, or maybe if you're getting an MRI, request music through the headphones, right? They can also help walk you through some deep breathing, or just kind of give you like, you're doing great, you've got this, just a little bit longer, give you that kind of pep talk that you need in the moment, right? They can also maybe offer you a warm blanket, right? A warm blanket can do wonders if you are feeling anxious and you're already in a cold medical room, right? It really makes the shivers come on, but a warm blanket can be comforting, can be soothing. That extra weight can feel really good on your body, right? So ask. They don't know if this is really nerve-wracking for you. Let them know. They're gonna have some tips, right? And if you need to stop, let them know. That's what they're here for. But again, just kind of driving in, I think, one of the themes that I think of today, right, is advocating for yourself. You know your body, so let somebody know if you need help in the moment. And then after, right? Like I said, I have a lot of people that say it's the after part where like their anxiety is just revving up because it was hard in the weeks leading up to the scan, it was hard in the scan, but now they're just constantly checking their phone. Right. So there's not an easy way and there's no way to speed up time, unfortunately. So try to engage in relaxing activities as much as possible, reading a book, watching a movie, listening to a podcast, going outside, right? If results are taking too long, right? Or longer than you were told that they would come in, reach out. Right? You want to let them know, like, hey, I was told it would take 5 days. It's 7 days. Where are my results? Right? Advocate for yourself. Be really cautious researching on the internet. It is so easy to do this, but it is also so easy to go down the rabbit hole, right? And it's very, very easy to read one article after another, after another, after another, and it's only rising your anxiety, right? So there is a lot of good information out there. I'm all about being as well informed as possible. But what I say is that the internet is not accurate to you and your specific body, your specific health, your specific family history, right? So you do need to be cautious with what you read on the internet. If you have an appointment, here's another great time to bring someone with you. They can again provide that distraction, but also in the appointment, as we already discussed, right, with Sarah, is that you can have them write down questions. You can have them help, like, kind of nudge you. If the doctor's like anything else, and your loved one can be like, yeah, remember you told me that thing happened last week, right? So they can kind of help you feel a little bit more confident in advocating for yourself, and they can take notes and just be that second ear. Okay, before we get into the practicing, I just kind of want to give that quick recap, right? Just to normalize that anxiety is very commonly felt, and a lot of times it's before, during, and after. So we're going to practice two skills really quickly together. And the first one is square breathing or box breathing. And so I always tell people, I know some people have their cameras on, some people don't. Do whatever is comfortable for you. I don't care that anybody ever knows the names of these coping skills. Some people call it box breathing, some people call it square breathing. Here's what I like about it. What I like about it is that it helps you to take some deep breaths, to slow your body down, but also it gives you something to focus on. A lot of times, people will just say, take a deep breath if you're feeling mad or sad or worried or something. But a lot of times as adults, we can take deep breaths, but we're still thinking about what's getting us revved up, right? So when you're doing box breathing, what you're going to do is you're either going to, if you're looking at this presentation right now on a monitor, you're either going to outline your computer monitor. Maybe you're looking at it on your cell phone, so you're going to outline your cell phone. Doesn't need to be a perfect square. Maybe it's going to be the door in front of you or a window. Maybe if you're doing this at the waiting room, right, you're going to trace a tile on the floor. Maybe you're going to trace a magazine on the table next to you, right? I tell people you can even trace your palm, right? We're not looking for a perfect square. The idea is to give us something to focus on, okay? So what we're going to do is just get yourself comfortable as you can. What you're going to do is you're going to inhale, and as you inhale, you're going to draw a line up. So inhale. You're going to hold your breath as you draw the line across. You're going to exhale as you draw the line down. You're going to hold your breath as you draw the line across. So you inhale, hold your breath, exhale, hold your breath. Inhale, hold your breath, exhale, hold your breath. 2 more times. Inhale, hold your breath, exhale, hold your breath. Inhale, hold your breath, exhale, hold your breath. I will say that people that find this to be helpful can utilize this again, not just when it comes to Scanxiety, but this can be a great way to just kind of center yourself. The one screening where I do think that this is challenging for is the MRI, right? Because they often tell you when to hold your breath and when to release your breath. But think about how you can use this in the waiting room. Think about this as maybe you're just having a doctor's appointment, right? And rightfully so, it's nerve-wracking. Do some square breathing then. With all of these techniques that I discussed today, practice as much as possible. It does not need to be long, right? So maybe every night now, when you're about to brush your teeth, before you brush your teeth, take a couple square breaths, right? Trace the outline of your mirror. Do it 2, 3 times. If you do it every single night, it really will become more routine and your body will automatically know to do it. And the second and last one we're going to practice today is positive imagery. So some people think of this as meditation. There are great meditation apps out there. You could find just great meditation videos on YouTube, right? But a lot of times what can help is in your trying to quiet your mind is to focus on something. So I always recommend like imagine a place that is very peaceful, serene, calm, or brings you joy, right? And you're going to describe it in great detail. So this is one, again, that you can utilize literally during some of these screenings, but you can also utilize it after or just practice this. Maybe if you're having a stressful moment, do this for maybe 3 or 4 minutes, and hopefully you'll find it's relaxing. So for this one, just get yourself comfortable in your chair. I'm going to utilize the image on the screen just to kind of help you walk through it. But really, when you're doing this on your own, you can choose any place in your mind to go to. Okay. So before we kind of set ourselves into this image, I'm just going to do 3 deep breaths just to kind of set the tone, slow things down. And so you're just taking your deep breaths on your own. And when you're taking your deep breaths, if you were to have a hand on your chest and a hand on your stomach or abdomen, you really want the hand on your abdomen to go out because you really want to take a full deep breath. So go ahead and take maybe 1 or 2 more deep breaths. And as you're taking that final deep breath and exhaling, we're going to imagine that peaceful scene. So here we are, we're on a boat on a lake. And I want you to just notice all the colors, right? Maybe you notice the bright blue lake water. Maybe you see the bright blue sky. Maybe there's a cloud. Maybe there's no clouds, right? Maybe you notice some bright green trees. Maybe you can see some rocks. Maybe you see a red cardinal flying by. Notice all the colors. When you're noticing your surroundings, wherever you are, you want to also take a full look around, right? So not just in front of you, but maybe when you turn to the right, oh, I see a dock. And on that dock, I see 2 or 3 boats. And maybe when you turn to the left, maybe you see a campsite. Maybe you see a green tent really far off in the distance. And then if you were to turn around in the boat, maybe you see a really far off distant highway. You just want to take in everything that you see. And as you're noticing the colors and noticing the different things that you see, now notice what you hear. Do you hear just the very gentle rocking and splashing of the water as the boat kind of goes back and forth and back and forth? Do you notice the wind rustling through the tree leaves? Maybe you hear just the tiniest sound from that red cardinal flying by. Maybe you hear some chatter and laughter off the shore. Notice what you're hearing. Notice what you're seeing. Take a deep breath and notice what you smell. What do you smell? Do you smell that campfire smell? Do you smell maybe some food, some yummy food that you packed with you in your boat? Do you really want to activate all your senses? So you notice what you see, you notice what you smell, you notice what you hear, and now notice what you feel. Do you feel the sun beaming down on the tops of your shoulders and the top of your head? Do you feel the crisp wind kind of floating by, gracing your skin as you're sitting outside? Do you feel for the first time that you can really just relax your muscles? Even right now, as you're sitting in the chair, do you notice your back sinking into the back of your chair, your feet just slowly melting into the ground? Notice what you see, notice what you smell, notice what you hear, and notice what you feel. Remind yourself that you can come back to this place anytime. This is your special place. I'm going to give you another minute to just enjoy the scene, enjoy your surroundings. Continue to take deep breaths when you can. And as you take your deep breath and you feel comfortable, you can start to open your eyes and we'll come back together. So these were the two that I wanted to demonstrate today. My hope is that you feel empowered, that you've got a couple new skills. And like I said, you really can utilize these not just when it comes to Scanxiety, not just when it comes to screenings, but just life, right? Life can be challenging. I do always share with people, right? When it comes to mental health, it is so important to prioritize this. I feel like it is fitting. May is Mental Health Awareness Month. So, if you are in the event of an emergency, go to the nearest ER or call 911. A lot of people don't know we also have a mental health crisis line, right? It's 988. Literally, you just text or dial 988 and you will speak with a licensed mental health clinician 24 hours a day, 7 days a week. So know that there is support out there. And then finally, what I would say is if you do experience anxiety, right, just to really reiterate, talk with your doctor about it. They might be able to, one, give you some tips, help you figure out how to manage it, or send you a referral to speak with a therapist like myself, right? We really want people to feel empowered and know that these are important screenings, but we know that it can bring on some really difficult feelings. So let's help you manage those feelings so you don't get behind on your screenings, right? And so you do reach out if you notice something going on in your body. So that's it that I have. I really appreciate that and kind of open up for questions. And I know we have another question to go back to for Sara.
Yes. So are there any questions? Thank you so much for sharing, Alana.
You're
Any
welcome.
questions for Alana?
I want to
Nope,
say I did share her handout. I shared her handout in the chat, but it's also going to come to you in an email after this. So later this evening.
There's lots of questions here.
Yeah.
Okay. Let me just, I'm just scrolling back up. Has anyone considered potential benefits to having therapy dogs at cancer screening locations?
You
Good
know,
question.
yeah, it's a great question. I can't speak for any particular place. I know in general, medical systems and hospitals definitely utilize therapy dogs. I think that's a great suggestion. I would encourage you to just bring it forward to your team. But yeah. I mean, at the very least, I tell people a lot if they have a pet, pets can be incredibly grounding. There's a lot of different techniques that you can utilize that doesn't help you in the moment when you're at the clinic, right? But bring that forward, or if you have a service animal, know that that is your right to bring your service animal with you. But yeah, great question.
And then this is just a comment, great tips, and this is very common. I love the advice of bringing someone with you, especially with potentially difficult conversations. Having a second set of ears and support is truly beneficial. That is so true. And then also, some institutions do offer therapeutic support dogs for those who would be interested. That's
Awesome.
good to know.
Yeah.
Also, there is a lot of therapy dogs in cancer centers, and I would love to see that adopted in other areas as well. And then another comment, I've never heard of them being utilized, specialized for scan anxiety. So was wondering if there was an untapped market there. True. And then great tools for all hard things. And then Sheila, your information is there too. So very good. I have a procedure on Tuesday, and I'll be using some of those techniques we practiced today.
Wonderful.
So let's go back to if Sarah, if you're able to quickly answer this. Go ahead.
Okay, go ahead. I think she did answer it in the chat, but go right ahead, Sarah.
I did. I
Well,
think
there's people on the phone too, so
yeah, I think 3D mammography, the question was really about using 3D mammograms as a diagnostic tool. Is it better than 2D? That is a very strong debate among providers. I think that there's some facilities that as they upgrade equipment are only putting in 3D. So I think that speaks volumes that if your facility is only doing that, that must mean that they really agree that that is going to be the new standard of care. I would still say that is for average risk. I am not, again, a provider, so I'm not sure that the data has really demonstrated that that could be your only tool if you're high risk. But that's certainly a conversation I would encourage anyone to have with their provider.
Exactly. Thank you.
okay, thank you.
So I appreciate you all who have stayed on. We've gone a little bit over, but as you can see, this information is so valuable. So I want to thank our presenters from the bottom of my heart for sharing.
Yes.
I know that everyone at least came away with something that was useful. We're hoping. I want to quickly tell you guys to save the date for our in-person event. We're going to have our annual community forum, September 12th. This time we're going to be having it at the Medical College of Wisconsin Cancer Discovery Center, which is a brand new building, beautiful. We'll be able to be in a place where not only will we be able to have our wonderful event like we did last year, but we'll also be among the scientists who have really been coming out with some new and innovative ways to beat cancer, to prevent cancer and to beat it. So I think the theme will certainly be around how we together will beat cancer, and it's completely possible. So I just want you to save the date for that. And again, we want to thank you. And Jacinta, I don't know if you want to ask them for feedback.
Yes, thanks again for zooming in on today. I know this afternoon probably was busy, so you took out your time on today. So I want to say thank you. But before you leave, we really value your feedback. So if you could please take the moment to scan the QR code, because it will help us to improve and better serve you and our community. So we really appreciate that. And thank you so much for being a part of this day.
Yes. Thank you. Thank you. Thank you.
Thank you all so much. Have a great rest of your day.
You too.
Thank
too.
you.
Terrific presentations. Thank you.
Thank you.
Thank you.